Ever wonder why somebody is having a shaking in their arms while they are perfectly sitting still? No, it's not fear, it's not caffeine overdose, it's not they're feeling chill. It is something called Parkinson's disease or Parkinsonism. Nothing but a problem with the movement manager in our body. So, what exactly is Parkinson's disease? So, the brain area, which is responsible for smoothness of movements with the help of a neurochemical called dopamine, is actually damaged or degraded. So, any disease that can cause this area being affected can lead into Parkinsonism. But in case it is a degenerative disorder, it turns up into Parkinson's disease. So, overall, we are deficient with one neurotransmitter, one chemical called dopamine. So, in need of this dopamine, we are looking for symptoms. So, what are the possible symptoms? The first and the most important symptom is slowness. So, slowness does not only count regarding walking. So, slow in walking will be the very first identified, but there will be much more things that are slow. So, slowness in thinking, slowness in talking, even the voice becomes slower and slower. Slowness in walking, slow hand movements while we are walking. So, second is tremor. So, this shivering can happen one sided, which is common, but it also can happen bilaterally in case the disease progresses and in later stages. Third, stiffness of the body. Everything, every muscle in our body feels stiff. It's not just arms. So, when you're trying to turn your head to one side, you almost notice that the whole body has to turn like a log of wood. So, that is when you should think that this could be more than just a stiff neck. So, along with the stiffness of the limbs, there will be stiffness of the throat muscles also, hence causing difficulty swallowing. Fourth, loss of writing reflexes. That is nothing but if you have a tendency of falling for any other obstacles, you will have writing reflexes by which you can protect yourself from falling also or from injuries that can happen because of that fall. But these are lost in Parkinson's patient. So they fall unwarned and also cannot, more often than not, cannot save themselves. So this is what is a major symptoms that happen during Parkinson's. But like most people think, Parkinson's is all about a shaking palsy. But is it really? No. Parkinson's will also affect a lot more functions because the smoothness of the body functioning is not just about hands and legs. So it does affect your mood, it does affect your memory, it affects your sense of smell, it affects drastically your sleep habits. And like I discussed, if the body has become stiff, not just the outer muscles but also the inner muscles, then definitely you will have difficulty swallowing and hence a constipation, difficulty passing urine. So every muscle in the body will become slow, stiff, and may shiver once in a while at rest, and even in motion, like even if you're trying to hold an object, it may shiver in later stages. So, is it really that bad? Yes, it is bad. But the good news is, if early diagnosis is done, Parkinson's is very much treatable. Because, like we discussed, the only problem here is dopamine is less. So, how can we bring up dopamine? So, one good thing that we can try at home is do everything that makes you happy. So, yes, dopamine is released. But here, the dopamine cells that release are damaged. So, there is no dopamine to release as well. So, here's when the medications come into action. We have to give the medication, which is actually dopamine. So we do give dopamine, but the timing of dopamine, the dose of dopamine is varied from patient to patient. There's another type of medication that we can give, that is boosting dopamine medication. They are not dopamine per se, but they boost the release of dopamine that is left in the body. Third is physiotherapy and exercise and balance therapy, speech therapy that will help the patient to use the rest of the physics and mechanisms that are left in the body to prevent from any further dangers because of this disease. And last but not the least, DBS, deep brain stimulation. This is a major procedure but minimally invasive. So this kind of procedure we can do to help the patient stimulate release of more and more dopamine from the less and the minimal cells that are left behind. So these are the possible options. So do not worry if you're having any such symptoms, because earlier symptoms have the best prognosis, and also some of them can run in the families. So if you're noticing anybody in your family with such symptoms, the earlier the better, because most of the Parkinson's patients will show some or the other symptoms in terms of sleep problems or smell problems at least 1 or 2 decades even before the shivering happens. So it's very important to understand, know, and recognize it so that you can get it treated early. So understand this disease and do not fear it. So stay safe, stay awesome, and I'll catch you in the next one.